Hi everyone, good evening. Welcome back to my channel. I say Ellie. So hope everyone is fine. So as in the previous in cornea part 1, I have described about the corneal anatomical structure and position, and the between of the six layers I have discussed about the three layers. Okay, that is epithelium, Bowman's membrane, stroma. Right, three layers I have discussed. So rest of the three is layer, that is Dua's layer, Descemet membrane, endothelium. Today I will discuss and blood supply and nerve supply of the cornea. Okay, so let's come. So Dua's layer, it is 15 micron thick, impervious to air, means it is not allowing any air or any fluid to the cornea. Okay, and it is formed by the collagen and proteoglycan. So proteoglycan means protein bond, one kind of mucopolysaccharide group from the mucopolysaccharide group. Okay, and some authors is telling that Dua's layer is Dua's layer is continuation of stroma, and some authors in some books you will see that this is the sixth layer of the cornea. Okay, and this is known as this Dua's layer. Another is known as also, this layer is known as a Predescemet membrane. Means Predescemet means you can see that this is the descent, right? So Predescemet is known as a Predescemet means it is means before. Okay, so Predescemet membrane. So Dua's layer is also known as a Predescemet membrane. Okay, now we will discuss about the. So I hope up to this is clear, right? Up to Dua's layer is clear. So up to this Dua's layer I have clear, okay, properly, right? Now I will discuss about the Descemet membrane. This is the Descemet membrane, okay? This is the Descemet membrane. So fourth layer is Dua's layer and fifth layer is Descemet membrane. So what is Descemet membrane? This Descemet membrane is thin. Okay, D membrane is thin but strong, is a homogeneous elastic membrane. Okay, and it is also formed by collagen and glycoprotein. Okay, thickness in Descemet membrane, it varies according to the age. That means at birth, during the birth, it is 3 micron. Okay, but if you see in the young adult, it is 10 to 12 micron in adult. Okay, Descemet membrane has a good chance to regenerate as like as epithelium. Okay, in our first layer, okay, epithelium is our first layer, so it is also regenerate after 20 to 72 hours. This is also regenerate, means if the Descemet membrane is affected, so it will be regenerate as like as epithelium. Okay, so I hope up to this it is clear. Okay, so last one and last membrane is endothelium. So we will discuss about the endothelium. Okay, endothelium. This is the last layer. So this is single layer and flattened hexagonal layer. Okay, this is single layer, flattened and hexagonal. Okay, and what it is, it is maintain that corneal dehydration, okay, which is known as deturgescence. Okay, deturgescence means corneal dehydration. Okay, so it maintains the corneal hydration. How? By pumping the excess fluid out of the stroma. Means if it is the fluid is excess, so it pumps, endothelium pumps the excess fluid and it from the stroma. Okay, so that is known as deturgescence. Deturgescence. Okay, means it maintains the corneal dehydration. Okay, now at the birth time, this is also varies. Okay, during the birth, it is 3000 cells square. Okay, but as the ages has increases, the cells started decreasing. Okay, so per year, every year it is decreasing 0.6% decrease. Okay, yearly, every year in every person, female male both. Okay, on during that case, when the cells is decreases, cells is started decreasing, the neighbor cells will start to enlarge just to fill the space, and this endothelium will never regenerate. Endothelium can't regenerate. Okay, it can't regenerate. So once it is damaged, means permanently damaged. Okay, now another thing is, in endothelium there is one word which is known as polymegarthism. Okay, polymegarism. Okay, and polymegarthism. Okay, these two words has invented by Dr. Gullupalli, the owner of LB Prasad. Okay, which is known as a LBPI. Okay, Gullupalli. Okay, so polymegarthism means polymegarthism means there is a cells decreases. Okay, in the endothelium the cells will be decreases. Okay, and polymegarthism means the size of the cells will be in differentiation in of the cells size and shape. Okay, if suppose this is endothelium. Okay, this is endothelium. So how it will be? Polymegarthism means the size and shape. If it is suppose this is the size of the shape, this is this is normal endothelium. Okay, so what will be happen in the polymegarthism? The size and the shape will be like this big. Okay, so this is polymegarthism. Polymegarism. This is polymegarism. Okay. And what is known as a polymegarism? That is the cell size will be decreases. The cell size will be decreases. If it is normal cells, the cells will be decreases like this way. Okay, polymegarthism and polymegarthism. Okay, now another thing I want to discuss. Now another thing I am going to discuss, that what happen if it is that endothelial cell will decreases less than, if it is less than 500 cells millimeter square. Okay, corneal edema will be start. Corneal edema. Edema means inflammation, as we know. Okay, inflammation of the cornea, and which will be, as if it is corneal edema is there, that means any infection is causes, or and the transparency of cornea will be lost. Okay, suppose this is normal cornea. Okay, this is normal cornea of our normal, this is normal cornea. Okay, what happen in when corneal transparency will be over? Okay, corneal transparency will be lost and corneal edema will occur. You will see this transparency will be not there, totally edematous. Okay, edema will be there, right? So if it is edema is there, so transparency will be lost. Okay, this is edema. Okay, so this is occurs when if any infection, it is caused by any infection due to of any bacteria, virus, fungi, so fungus. So due to this edema will be there. Okay, it is a normal eye, normal cornea, where that's why the transparency is there. Okay, so endothelium is playing a vital role for transparency. Okay, now, and if it is edema, so any bacterial infection, any viral infection, any fungal infection, edema will be there. Okay, as the edema will be there. Okay, edema can occur due to of any reason. I mean, if there is a pus formation. Okay, so during that time edema will be there, and transparency will be hazy, means cornea will be hazy. Transparency lost means it will be not totally lost, that will be cornea will be hazy, means the patient will not able to see the near object or any front object yet clearly. He or she will see the hazy. Okay, now I will tell about the blood supply. Blood supply. In Remington, it is tell cornea is not a total avascular. Okay, in some authors it is told that cornea is totally avascular, but cornea is not a total avascular. Okay, cornea not avascular. Okay, so how why cornea is not avascular? Because in perilimbal vessels, anterior ciliary vessels is supply. Anterior ciliary vessels. Okay, vessels, through that blood supply is there. Okay, So cornea get the nutrition from there, nutrition. Okay. Now what is the nerve supply of the cornea? Okay. And yes, aqueous humor is also plays a vital role in the cornea getting the nutrition. How? Diffusion and active, through the diffusion and active transmit. Okay. And cornea has taking in oxygen from the atmosphere. How cornea is how oxygen is provided to the cornea? From the atmosphere. Okay. Oxygen cornea is take from the, means 100% cornea, 100% oxygen cornea gets from atmosphere. Cornea gets from atmosphere. Okay. From atmosphere means from nature, air. Okay. If a person is going to higher level, means any mountain or any trekking, on that condition cornea oxygen level become decreases, and cornea will, and the patient will feel, and the person will feel dry eye. Okay. In high altitude, means in any mountain, if it is gone, anyone is going, so in mountain oxygen level will be decreases and cornea will become a started dry. Okay. So I hope I have clear up to this. Now the last is nerve supply. Which nerve is supplying the cornea, I will tell. So in nerve supply, this is nerve supply. Okay. Fourth nerve, ophthalmic, fourth nerve, ophthalmic division, trigeminal nerve, that is the fourth cranial nerve, trigeminal nerve. Okay. So trigeminal nerve is supplying the cornea nerve supply. So hi everyone, so I hope I have cleared that the cornea's anatomical and anatomical position and the structural position of the cornea. So these are the anatomy of the cornea. Okay. So please, I hope you like this video, so please like, share and subscribe my channel, and definitely share my share my channels. Okay, share my videos. Okay, so till then, bye. So tomorrow I will discuss about the conjunctiva. Till then, bye.